name is Tim McLean. I am a nursing student at the University of South Alabama, and today I'll be performing my IV insertion. Here's my jack card. Okay, you can scan the room. Okay, first thing I will do is verify my patient care order form with the hospital policy, and then I would wash my hands. I will also list two identifiers. His name is Jaguar Jones. Jaguar Jones, his date of birth is 08/25/1963. 08/25/1963. And he's allergic to penicillin. I will also provide privacy for my patient and also explains the procedure. Next thing I will do is move the trash can, do hygiene again, and then don my goggles. Okay. Next, I will raise the bed to a working height, lower the side rails. I also like to know this is below my waist. Normally, to maintain sterility, it will be at waist level. And then I will also lower the side rails and make sure my patient is comfortable. He will either be in a supine position or a sitting position, whichever is comfortable for the patient. Okay. Next thing I'll do, gather all my equipment and open my packages. Okay. Once I open all my packages, I will get my alcohol wipe, and then I would do this with the with this. Open it. And then I will clean this off. Then I will dispose of it. Next, I will get my needle. Pop the cap. Then I will also flush. And then I would attach. Okay. Then I will also put this back into the package. Okay. Next thing I will do is once I put this back into the package, I would also like to list 3 things for assessing a vein. You have to make sure the vein is large, spongy. You'll also make sure it's on your non-dominant hand. And you also have to make sure it's non-dominant and it's distal. For 3 things for assessing a venous distension, you'll also make sure you open and close your fists. It is dependent, and you also stroke the vein. Next thing I'll do, I'll move everything closer to my patient. Okay. And then also I'll put the tourniquet on. It'll be 4 to 6 inches above the site. Normally, my patient would move. Okay, and I'll make sure it's tight. Next thing I will do is I'll get I would check the radial, and I will assess the vein. Then I'll get my before I do that, I'll put on my gloves. Once I do that, I will get my chlorhexidine wipe. It will go, I'll clip it, and it will be vigorously back and forth, horizontal, vertically, and in circular motions. And I'll do this for at least 30 seconds. And then I will wait for it to dry. Once that has dried, I will take these out of the packages. Okay, I'll get my needle. I will do this bevel up at a 10 to 30 degree angle. And then I would spread the skin. Okay. Once that in, I will lower it and then advance it 1/4. 1/4. And then I would release the tourniquet. Release the tourniquet, apply pressure, and I will put this up and release my normally I would do this, but I will this and release this, and I will observe for blood return. I will put that in there, and then while I'm observing for blood return, I will quickly put this I'll remove my cap first. That was the issue. And then I would do this. Then I will wait. Then I will pull it back and I'll wait for a blood return. And then I will flush. But I'm not going to actually flush it. And then I would remove this part and then put this in my sharps container. Once I put that in my sharps container, then I will get my tape, temporary tape, and I'll tape it. Okay. Then I'll get my Teddy-Gun. Put that in the trash. And then take this without the hub. Make sure it's smooth. And then I'll go around it. Get this off. I would save this part. And then I will get another piece of tape to tape this together. So it can be stable. Next, I will take off my gloves. I will get my label. And I'll write my time, date, and my initials on it. And I'll put it at the edge of the dressing. Then I would lower the bed to side rails. Lower the bed, raise the side rails. Put my call light near my patient. Make sure my patient is comfortable. I'll also teach the patient about to prevent dislodging and any signs and symptoms of IV complications that may be. Next, I'll wash my hands. And then I'll document. I'll document how many times it took me to do it, my patient's date, time, the drainage, the consistency, the patient tolerance, anything like that. I would document. And then I would make sure my patient is comfortable after I document and stuff. Next, I would do discontinue. I'll put my gloves back on. Then I will do it from around the site. Going away from the site. Okay, and I'll throw that away, and I'll get the tape. Okay, then I would take my non-dominant hand with my gauze. I'll fold it and I'll put it right here. With my dominant hand, I will slowly take the needle out, put it in my sharps container, and then I will check for any pain, swelling, any drainage, anything that I could document. Then I will take my gloves off. I'll wash my hands, make sure my patient is comfortable, and then I should conclude this video.